Hi, my name is Melissa. I'll be your nurse today.
Hello.
I'm just going to go over here and wash my hands before we get started. And today I'm going to be doing a more focused exam of your skin, hair, nails, neck, head, and also your lymphatic system. So first I'm going to go ahead and have you just remove your shirt so that I can get a full visual of your skin here. As I'm looking at you, I'm looking for any lesions, any scarring, anything that would be abnormal or concerning. Today we're going to go ahead and forgo any prostate or rectum exam. I'm just going to be looking at your skin. I do note that there's, as I look from head to toe, I note that there's a couple red papules here, and none of them appear to be concerning or anything like that. What kind of skincare products do you use at home?
It's like coconut oil.
Okay,
Okay.
great. Yeah, you just don't want to be using anything that would be harsh or anything on your skin. I do note that there is a few nevi here, and I am going to assess this with the ABCDE method. I'm looking for any asymmetry. I'm looking at the borders, any irregularity. I'm also looking at the color. And then the diameter, we would like it to be less than 6 millimeters. And then also feeling to see if it's elevated. If there were any concerns with any of these nevi that I have seen so far, what I would do is have you talk to your doctor and make sure that you see a dermatologist or anything to have those checked out. I'm also going to go ahead and check your back just to make sure that there's no concerns there. And I don't see anything of concern. All right, I'm gonna go ahead and move down. I'm looking at your hair right now, and it appears to be a normal male hair distribution. I am going to go ahead and look at your legs. As I'm feeling and palpating your legs, I'm going to be, and throughout your whole body, feeling for temperature, texture. I'm feeling to make sure that it's warm, that there's no edema down here, and that you don't have any varicosities. I don't feel any edema or anything. Your pulses are good in your feet. This is all just looking for circulation throughout your body to make sure that all of your limbs are getting good circulation. What I'm going to do is go ahead and look at your hands now. I'm going to look at your skin turgor bilaterally, and that's going to check for dehydration or anything like that. And there is none that I can see. I'm going to go ahead and look at your nails, and they appear to be concave. There's no ridges, there's no clubbing, there's no cyanosis. I'm also going to go ahead and check your capillary refill, and that is less than 3 seconds, which is what we like to see. And I'm going to check that bilaterally. All right, I'm going to go ahead and move on to just a few tests here that I have today. I'm going to go ahead and just do an assessment of your head, and I'm going to start with your eyes. I'm going to have you go ahead and just look straight ahead, and I'm going to just check your pupils, making sure that they're round, equal, and reactive, which they are. Just going to look back here, looking further back in your eyes, just looking at the retina, making sure that there's nothing that is concerning. All right, excellent. I am going to go ahead and just palpate your head while we're here. And I'm looking for any infestation. I'm also looking for bruises or bumps. Just let me know if you feel any tenderness as I'm palpating. And there's no signs of alopecia or anything that would be concerning, and there's no signs of infestation or anything like that. I'm also going to go ahead and move down and palpate your paranasal sinuses here. I'm just feeling for any tenderness. I'm also going to go ahead and feel your temporal mandibular joint here, and I'm going to have you open your mouth wide and close it just a few times. And I'm feeling for any crepitus or any click. All right, just checking the movement there. I'm gonna go ahead and check your paravertebral muscles and your cervical spinal muscles back here. Just making sure, go ahead and tip your head forward a little bit. All right, and I'm just making sure that they all have good movement and no concerns there. I am also going to have you tip your head back, and I'm going to be looking at your septum to make sure that there's no deviation or anything there. And then I'm also going to look inside your mouth. I'm going to have you open wide, and I'm going to go ahead and count your teeth. And I do note that you do not have your wisdom teeth, but I am counting your other teeth to make sure that they are all present. And it does appear that they are all there. I do see a few fillings, but there's no open, like dental caries or anything like that that would be concerning right now. I'm also looking around your entire mouth, looking for lesions, any white patches, any sores, or anything that would be concerning. I'm also looking at your tonsils to make sure that there's no swelling there. And I'm going to have you go ahead and tip your head forward just a little bit so that I can see a little bit under your tongue here. Go ahead and lift your tongue up. Excellent. And then go ahead and say, ah.
Ah.
All right, and I'm looking at the uvula in the back of your throat, and that appears to be moving freely, and that's good. All right, I am going to do just an examination of your ears now. First, I'm going to just palpate them and make sure that there's no tenderness in your ears here. And then I'm also going to look inside of your ears bilaterally, and I'm looking for the tympanic membrane, just making sure that it's white and pearly in there and that there's no redness or any signs of infection or anything like that. I'm going to go ahead and check this ear over here. All right. And I'm also going to do what is called a Weber and also the Rhine test for hearing. What I'm going to do is I'm going to hold this in position A, and then I'm also going to hold it on a bony prominence behind your ear, and that will be position B. And just let me know if you hear it better in section A or section B, okay?
Okay. A.
All right. We're going to do this side.
A.
All right. And then I'm going to go ahead. Also, throughout this exam, after I use these tools, I'm going to set them to the side so that they can be sanitized and everything after I see you today, so that they'll be ready for the next person. I'm going to whisper a word, and I want you to tell me what the word is and which ear you hear it in, okay?
Rain. Left ear. Waterfall. Right ear.
All right, excellent. I'm also going to go through and check a few of your cranial nerves. We're going to go ahead and start with cranial nerve 5, and that is the trigeminal nerve. I'm going to just go ahead and assess the motor and the sensory function of that trigeminal nerve. First, I'm going to have you go ahead and try to, against pressure, open your mouth. All right, and that's just feeling your jaw. Go ahead and clench your jaw. All right, excellent. And then go ahead and turn your head into my hand. All right, I'm going to check both sides. All right, excellent. And I'm also going to take this to check the sensory of the ophthalmic, the maxillary, and the mandibular divisions of your face. What I want you to do is to tell me if you, I'm going to have you close your eyes tightly and tell me if you feel a sharp or a dull sensation as I do this, okay?
Okay. Sharp. Dull. 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 Sharp.
Excellent. I'm also going to check your facial nerve, which is cranial nerve 7, and I'm going to have you go ahead and smile, and then go ahead and frown, and squeeze your eyes shut. Go ahead and raise your eyebrows. Go ahead and puff out your cheeks, and then purse your lips. All right, excellent. I'm also going to check spinal nerve 11, which is your accessory nerve. And I'm going to have you go ahead and try to shrug your shoulders against pressure here. All right, excellent. As I'm going through all of this, I'm also checking for range of motion and all of that, as well as feeling the temperature of your skin and all that kind of thing. And I'm going to go ahead and look at your neck a bit closer here. What I'm going to do is just palpate your trachea. And also while I'm here, feeling your thyroid as well. What I would like to do is go ahead and do a test for your thyroid. I'm going to have you take a drink and just hold your head slightly back as you swallow, so that I can make sure that your thyroid is moving up in the butterfly shape that it should. All right, excellent. And I'm also looking to see if there's any goiter or anything like that that I can see or palpate on your neck, which I have not seen or palpated. I'm going to go ahead and auscultate over your carotid artery, and also just making sure that there's no bruit over your thyroid or anything like that, okay? All right. I'm going to go ahead and move on to the lymphatic portion of the assessment. I'm going to just palpate your lymph nodes. As I palpate these pre-ocular lymph nodes, and with all of the lymph nodes, I'm going to be feeling for tenderness. I'm going to make sure that they are movable. These are the post-auricular right here behind your ears that I'm going to start feeling. I'm making sure that there's no hard lumps, that there's no tenderness, or anything that would be concerning throughout feeling these. I'm going to feel the submental lymph nodes right here underneath of your chin, and then moving back to the submandibular. Right. And then right back here are the tonsillar lymph nodes, or the retropharyngeal lymph nodes, whichever one you want to refer to them as. I'm also going to go ahead and feel back at these occipital lymph nodes back here. And then also I'm going to go ahead and have you turn your head away here, and I'm going to feel these deep and posterior cervical chains here. Sometimes it helps bring them out a little bit so that I can palpate them when you turn your head. Go ahead and try the other way here. All right, and then I'm also going to palpate the supraclavicular lymph nodes that are right above your clavicle. Okay. All right, and that is everything for today, okay?